So a few weeks ago, I was sitting across from a woman named Linda at a coffee shop in the suburbs. Late afternoon, half-empty place, the espresso machine going off every few minutes behind us. She was 61, had just retired from a career in marketing, and she looked tired in a way that wasn't about the day. She slid a piece of paper across the table. It was a quote from a private health insurance broker. The number at the bottom was $1,847 a month. For her, just her. Her husband had a separate quote that was almost as much. She said, "Nobody told me this is what it costs to retire before 65." That's the conversation almost nobody is having with you about retirement, and it's the one that quietly derails more retirement plans than people realize. Here's what most people don't understand about retirement healthcare. There are three distinct cost problems hitting at three different life stages, and the financial industry talks about exactly zero of them in any real way. Problem one is the pre 65 gap. If you retire before 65, you are not on Medicare yet. You're buying insurance on the private market, and the private market does not care that you're retired. A couple in their early 60s with no employer coverage is looking at $3,000 to $4,000 a month in premiums before a single doctor visit. That's $36,000 to $48,000 a year every year until Medicare kicks in. If you retire at 60, that's 5 years, roughly $180,000 to $240,000 of pure premium expense before you've consumed any actual healthcare. Most retirement calculators don't model this. Most financial advisors don't bring it up, and most people don't find out until they're sitting across from a broker like Linda was. Problem two is the Medicare misconception. Most people believe that once they hit 65, healthcare is handled. Medicare covers it. Done. Medicare does not cover dental. It does not cover vision. It does not cover hearing aids. It does not cover most long-term care. The premiums for Part B and Part D are not zero. They're income adjusted, and they can run $200 to $600 a month per person. Supplemental Medigap policies, which most people need to avoid catastrophic out-of-pocket exposure, add another $150 to $400 a month. The honest number for a couple on Medicare with supplemental coverage and prescription drug coverage is roughly $700 to $1,200 a month combined. Not zero, not handled, a real recurring expense for the rest of your life. Problem three is the one nobody wants to talk about: long-term care. About 70% of people over 65 will need some form of long-term care during their lives. The average cost of a private room in a nursing home is now over $110,000 a year. Assisted living runs $55,000 to $75,000. In-home care, depending on hours, runs $50,000 to $100,000. Medicare does not cover this. Let me say that again, because it's the single most important sentence in this video. Medicare does not cover long-term care. Medicaid does, but only after you've spent down almost all of your assets, meaning you've drawn down your savings, your investments, and in many cases your home equity to a state-defined threshold before coverage kicks in. Long-term care insurance exists, but it's expensive and harder to qualify for after 60. And a lot of policies sold in the 1990s and 2000s have had premium hikes that priced people out of the coverage they thought they were locking in for life. The average length of long-term care need is about 3 years. Do the math. A couple where one spouse needs 3 years of nursing care is looking at $330,000 in costs that Medicare will not touch. Quick check-in. Of those three problems, the pre-65 gap, the Medicare misconception, or long-term care, which one were you least aware of before today? Drop a 1, 2, or 3 in the comments. I'm genuinely curious which one this audience knows the least about because it changes which video I make next. Here's the part of this nobody says out loud. The reason these three problems don't get talked about in any real way is that the people who advise you on retirement are not the people who pay for your health care. Financial advisors model your portfolio. They don't model your insurance premiums. Insurance brokers sell you a policy. They don't model your retirement drawdown. The two conversations happen in two different offices with two different people, and the gap between them is where most retirement plans quietly fail. The retirement industry sells you a number, your nest egg target, and that number almost never includes a realistic healthcare cost projection. The honest number for healthcare across a 30-year retirement is somewhere between $300,000 and $500,000 per person, not including long-term care. With long-term care, it can exceed $700,000 per person. Most retirement plans budget a fraction of that. So, what do you actually do? 3 actions in order of leverage. 1. If you're planning to retire before 65, get a real private insurance quote for your age and zip code right now, today. Not an estimate, a quote. The number will shock you, and it should, because that number determines whether early retirement is actually affordable for you. 2. Build a separate healthcare line in your retirement budget, not a percentage of expenses, a specific dollar figure that escalates with healthcare inflation, which has been running 5 to 6% a year, faster than general inflation. Most planners use 2 to 3%. That gap compounds into a six-figure shortfall over a 30-year retirement. 3. Make a decision about long-term care before you turn 60. Either buy a policy while you can still qualify, self-insure with a dedicated portion of your portfolio, or accept Medicaid spend down as your fallback and plan accordingly. The default choice, doing nothing, is also the most expensive choice. It just doesn't feel like a choice, which is exactly why it's the one most people end up making. Back to Linda at the coffee shop. She didn't retire. She went back and negotiated a part-time arrangement with her old employer specifically to keep the health coverage until 65. She told me later it was the right call financially, but it cost her something she couldn't get back. 4 years of the retirement she'd been planning since her 40s. The cost of not knowing this stuff isn't just money, it's the version of retirement you don't get to have because you found out too late to choose differently. Healthcare is not a footnote in your retirement plan. It's one of the 3 biggest line items, alongside housing and taxes. The fact that nobody frames it that way is the actual problem. You can fix that for yourself by treating it as a line item starting today. You don't need to solve all 3 problems this week. You just need to stop pretending they're not there.